Welcome to World Pharmacy Week. My name is Pharmacist Manager and I'm the Marketing Manager at Pohamba Private Hospital. Our guest today is Mr. Rian Kutzer, our Pharmacy Manager. Today's topic is drug dependence. What is pharmaceutical drug dependence and how does it differ from drug abuse?
Pharmaceutical drug dependence occurs when someone becomes reliant on a prescribed medication to function normally. It differs from drug abuse, which is when a person uses a drug or illicit substance to achieve a high. Dependence on these type of substances can occur even when taking the medication as prescribed. So it's still not necessarily drug abuse, but it becomes something that the person is dependent on.
Very interesting. What are the signs of prescription drug dependence?
Signs of drug dependence may include needing higher doses to achieve similar effects, experiencing withdrawal symptoms when trying to stop, difficulty controlling the use of the medication, and continued use despite negative consequences. Physical, emotional, and behavioral changes may take place, and these people might be moody or unhappy or dissatisfied when you try to change the drug regime that they are taking.
Okay. And which types of the prescription drugs are most commonly associated with drug dependency?
The most commonly associated drugs at the moment are the class of opioids. So these are drugs like codeine, morphine, pethidine, fentanyl. Codeine is commonly available as an over-the-counter drug, and it has a massive misuse potential. Then tablets used for helping with sleeping or insomnia. These are drugs like zolpidem, zopiclone, and then also your benzodiazepines, which is a class of drugs that are used to treat anxiety. These drugs are quite addictive.
What steps can somebody take to reduce the risk of developing dependence on prescription medication?
So to minimize risk, you can follow your prescribed dosage correctly. Consult with a doctor before increasing the dose or stopping medication abruptly. You can also discuss alternatives or non-pharmaceutical therapies with your healthcare provider, and regularly assess your need for the medication with your doctor, in consultation with your doctor. Is the pain still present or is the pain gone? And then also you need to store medications securely in places where people cannot reach it.
How can a community support individuals struggling with pharmaceutical drug dependence?
They can support affected individuals by reducing the stigma around dependence and encouraging open conversation. It's not a bad person who has become dependent. It's not someone who is evil. Dependence is something, it's a condition that happens due to the use of a drug. And then also promoting access to resources such as counseling, support groups, or even treatment centers.
And awareness. This podcast was proudly sponsored by Pohamba Private Hospital. If you've got any questions, please visit your healthcare service provider today.